would like to recall, though, to members that this is a budget that does increase spending from the current levels of 6%. Senator Hoffman mentioned that. There are some cuts. There are a few cuts that are absolutely cuts. But a lot of the things that we're talking about that are being called cuts are reductions from forecasted levels of spending. In the course of some of the debate here, I heard some discussion about the child care rate reduction expenses, and we are taking about a $14 million reduction, but that is a reduction from a forecasted increase. We are currently funding that particular area of the budget, $176 million. Our proposal calls for an increase to $214 million. That's a 22% growth in that line item. Now, it's not quite as high as what the forecast calls for, but I would argue that is not a cut. That is an increase, but may not be as much of an increase as the forecast would ask for. But this is a 6% increase overall. I would also say that this bill does not eliminate every need that we have in the state. What we're doing today doesn't eliminate every need that we have in the state. The governor's proposals don't eliminate every need we have in the state. There is no bill, there's no budget that will eliminate every need we have in the state. We are doing the best, I believe, with what we have. And that's what we all do in our personal lives and the lives in our community. We all try to do the best we can with what we have. But one of the things that we've tried to do in this bill, that I've tried to do, that when I took on this job that I thought was important, is that we try to set a different course, a course that is sustainable. And what we're doing right now, and the path we are on, we cannot sustain. And so we need to change that. And so what we try to do is talk about how can we restore greater sense of personal responsibility and freedom for us as a state and as individuals in this state to make decisions about our health care. And how can we do things to help people who have perhaps not the means right now to help them be in a position to make decisions about their health care. And that's what we have tried to do.
And so the longer we spend on a bill like this that isn't balanced, that won't be signed by the governor, the longer it takes to get around to working on a bill that is a serious effort to balance the budget. And time is running out. So let's put this bill to bed right now by voting it down so we can start over and get a balanced bill that might be signed by the governor. Other reasons to vote against this bill. Over 200,000 people in this bill in the state of Minnesota will lose their health care through our health care programs. 836 people who are elderly and frail and disabled will lose their community-based services and be forced into institutions. This bill is a job-killing bill. There'll be over 40,000 jobs in the state of Minnesota lost. And that doesn't even count the jobs in the departments. These are private sector jobs in nursing homes, hospitals, group homes. This bill will raise property taxes. I'm sure some of you thought only the education bill or the tax bill raises property taxes. No, this bill will raise property taxes also. It increases costs to the counties by $118 million, and translated to property taxes is about a $59 million property tax increase around the state. The bill repeals the medical assistance early enrollment, and it replaces it with the old CDDS program, but the old program gave providers, the hospitals that signed up, $6,000 on average per person to provide health care. This bill gives $2,000 per person for health care. So it's very unlikely anyone would sign up for it to be a provider. But beyond that, the governor's already made it very clear any bill that repeals the early MA enrollment will be vetoed.